shift focus. Let's talk about the health sector. The National Health Insurance Authority says it is taking steps to settle all outstanding claims owed service providers. The assurance follows claims by the minority in Parliament that the National Health Insurance Service providers may withdraw their services due to the non-payment of levies by the Finance Ministry collected since July 2021. Already, the NHIS is grappling with the challenge of fraudulent claims, which is said to be affecting the cost of operation. However, addressing the press today on measures being taken to improve healthcare delivery, Chief Executive Officer of the National Health Insurance Authority, Dr. Lydia Jani-Salisbury, says the scheme is sustainable and that steps will be taken to consolidate the gains.
We are sustainable. This scheme, I don't care what anybody says, is one of the best designed schemes, health insurance schemes in the world. However, as typically faces Ghana, we set up a good plan and then we don't follow our own plan. And I think we have some implementation challenges. As I said, we pay about 90 to 95 million a month cedis for claims. And this is new Ghana cedis, not old Ghana cedis. And we have just paid August 2021. And we have received, some people have brought their Januaries, but the bulk are December. So 4 months times 90 million. Let's say about 360 million plus. That doesn't include those who haven't brought their claims in yet and things like that. Yeah. We put a few people in prison, which is the figures. The one I was personally involved in stemmed from 2009, and in those days it was 500,000 cedis. The person was jailed, I think, in about 2016 for 10 years. I think his assets are being sold or auctioned or whatever to give us back the money. 500,000 now is not worth what it was in those days, but we put in measures that has reduced this. And one of them is this mobile renewal. You know, when you go to the hospital now, the facility, they have a special short code, not the star 929, for which they must authenticate every visit. And we give you a code that you put on the claims if the person is a genuine member of the NHIS. At the same time, a message is sent to the member, and it gives you the name of the hospital or clinic that is going to make or claim for money in your name. And because of that, some of the fraudulent claims have gone down.
Well, so that's the assurance coming through from the NHIS, but how do we improve on the state-owned enterprise and to make it more efficient to promote health delivery here in Ghana? Joining us now is Dr. Thomas Anaba, Executive Director for the Africa Center for Health Policy Research and Analysis. Thank you so much, sir, for your time. So here we are, the NHIS is assuring that, well, first of all, claims will be dealt with on time, and then other issues relating to fraudulent claims would also be addressed. Looking at the scheme in itself, how do you think we can first of all improve delivery?
Very much. I think it's not the scheme, it's the service providers, how we should make sure they are able to provide quality. The scheme is well crafted, the act is properly looked at, it was well designed. The problem is the disbursement of funds, because no hospital would like to provide services that are not of quality, that are challenging, that would not inure to the benefit of the patient. And they sometimes have to do what they have simply because the NHIS is owing a lot of facilities huge sums of money. Just heard the chief executive complaining that 500,000 some years ago is not worth what it was. The hospital 6 months of his money. Just do that. Today you want to pay him, he has several thousands from that money. So it is up to the scheme. Well, the most important thing we should do to the scheme now is that we give the scheme the money it deserves, and the money that is accrued to taxes. You can't have two over 2 billion as taxes paid for as a levy for national health insurance. Poultry sum of 170 something million.
Dr. Naba, we're having challenges hearing you. If you could just address that for us. But then you're talking about ensuring that we scale up the funding that's provided NHIS. But the point is, how about, first of all, making use of what they have? The indication we're getting from management is that, well, they're trying to expand their services and also make use of what they have. But then you're saying we should pay attention to the finance ministry and those in charge of the government kitty. Why?
They are relegating one of their functions. And ordinary people pay for it to be given to them to work because they are handicapped as a result of lack of funds. They are not able to deal adequately with the service providers. Therefore, this is to client or turn clients away, or clients have to pay right away. Cardinal duties is to ensure they get money from the finance minister, and that is what they are not doing. That is what some of us that we are shortchanging we Ghanaians. We pass a law that will all contribute into a pool that will help to mitigate what we call provide some financial risk protection for Ghanaians.
Well, yet again, we're losing you, Dr. Naba, but let's touch on the issue of the claims. How do we make it more efficient? And I'm hoping that this time around your connection will be much better. But how do we deal with the issue of the claims, ensuring that it's timely, and also dealing with fraud, which is sometimes crippling the system?
And make sure that every hospital use a digital platform.
Well, we seem to have lost Dr. Thomas and Naba again. It appears that the lines are not favorable. Dr. Naba, well, we'll try and raise you on the phone lines, but what we are looking at is the NHIS, obviously, the fact that government is attempting, and also the service itself is attempting to improve on its services. But Dr. Naba, let's try one more time. You are on with us. Let's see if we can hear you clearly. Well, so Dr. Thomas Anaba is still with us. Earlier, we're having some challenges with the connection. Dr. Anaba, you were making the point about, improving that aspect of NHI, and also just feeding into this report as well issues about cancer as well and some other chronic diseases that we're supposed to be considering when it comes to the NHIS. How do we go about that?
I think, as I was saying, to improve upon the systems of NHIS payment system as well as dealing with the fraud, what we need to do is to automate the whole system, make sure every facility has a digital platform upon which it should work with its folders, linking this to the National Health Insurance, linking this to the claims, so that any case that you see is quickly sent to the National Health Insurance Authority for vetting and approval, and then information sent to the client, just like some of the private health insurance have. In that way, we'll be able to control and minimize what is the fraudulent way people may be sending claims for work that they have not done. And besides that, it will also speed up the time for reimbursement so that facilities can work very, very quickly. Yeah, talking about non-communicable, Ghana, we need to adopt what we call preemptive measures towards this through education and also making available as avenues for people into our various hospitals at least a year to do some checkup on their own, even if it is to be covered by National Health Insurance. At least most of the people who really suffer these non-communicable diseases are the elderly. Most of them they have less money to pay for their services. I'm not talking about children, but majority of the major cancers are suffered by the elderly and women. So we think that some special consideration can be made to such groups of people in terms of some of those sicknesses so that it can be covered. Not only this, but hospitals, especially government hospitals, should be provided with the needed resources to quickly diagnose such diseases, give treatment, and give medications so that those people do not suffer the consequences of having to die because they don't have resources to be diagnosed of their ailment. If you check northern Ghana, we don't even have a cancer center. We don't have a cancer center. So how many people are going to get their prostate cancer diagnosed, get their breast cancer diagnosed, even common mammography we don't have. So it is up to government to also resource facilities with the needed equipment, include those things, those illnesses into the National Health Insurance package, because the health insurance, as the CEO said, has a lot of money. It's one of the best in the world. It accumulates a lot of money, just that it doesn't go to them. If the money really goes to them, they'll be able to take care of these diseases. So up to government to up the game of education about communicable diseases, provide the needed resources, and pay hospitals in time to continue taking care of people.
Do we consider laws in that regard?
Come again?
Do we consider framing a law in that regard?
I think it is just to upgrade what the National Health Insurance has already. It should be a policy under the National Health Insurance that these ailments should be added to it, just like they've been able to add childhood cancer to it. They can add other cancers to it, because the old man with 70 years is no more on salary, he's on pension, he can't get money to pay for a scan, he can't get money to pay for his surgery, he can't get money to pay for any chemotherapy or radiotherapy. Just like many women who are single mothers, they can't get money to even do a mammography. How do they diagnose? So I think that they can just incorporate that into it and provide it. Then we don't need to create more things. We just have to tweak the law or add those services into it so that facilities can provide it.
Dr. Thomas Anava, thank you for making time for us.